I'm Hayley Carney, an accredited exercise physiologist and ESSA member. I'm here to tell you about how exercise physiologists can assist with mental health and well-being across the Australian population. I'll briefly cover what an AEP is, how we integrate into allied health teams, why an AEP-led therapeutic exercise program is beneficial to your patients. An AEP is university qualified to provide evidence-based exercise interventions. Broad in range, AEPs work in acute to chronic care, in private and publicly funded roles. An AEP may be utilised in a proactive manner to avoid the onset of chronic health conditions and to treat chronic and complex conditions alongside musculoskeletal injuries. With a strong awareness of a holistic role as a multidisciplinary approach to healthcare should take, AEPs regularly work alongside specialists, GPs, nurses, psychologists, psychiatrists, OTs, physiotherapists, dietitians, speech pathologists, diabetes educators, and many other community-based roles to ensure a well-rounded guide for the patient. In the space of mental health and well-being at work, AEPs are regularly sought by private enterprise and corporations to collate baseline health data, provide education sessions, and recommend interventions to assist with ongoing employee health that is achievable and sustainable for both employee and the employer. Specifically looking at mental illness, the burden of disease is palpable across the Australian population, with 1/2 of Australians experiencing mental illness at some point in their life. People with mental illness experience poorer physical health. People with severe mental illness live between 10 to 32 years less than the general population. As of January 2018, the Australian government has put $110 million towards child and youth mental health services. When solely addressing the treatment, research into mental health and exercise has been ongoing since the 1980s. In 2014, a review of 4 meta-analyses focusing on exercise and depression found that exercise intervention outcomes were comparable to antidepressant medication and psychotherapy, and exercise as a complementary therapy assists the treatment of severe depression. Persons with mental health conditions commonly present with complex health concerns such as CVD and type 2 diabetes. In this regard, exercise as a therapeutic approach can be a powerful tool in the area of prevention alongside ongoing treatment. Given the rising rate of mental health concerns running parallel with the obesity epidemic and the subsequent impact on the healthcare system in Australia, providing a treatment pathway that elicits positive outcomes in both the physical and mental arenas is a golden opportunity. A referral to an AEP results in the use of motivational interviewing techniques to support behaviour change. Given the broad access points within our scope of practice, AEPs are able to assist patients in the areas of motivation versus amotivation, weight loss in the face of complex conditions, education on sleep behaviours, and overall quality of life. This includes social and occupational functioning, allowing for the important component of a social inclusion into a patient's treatment program. Referral to an exercise physiologist can occur at any time, preventatively, post-operatively, in conjunction with other allied health treatments. An exercise physiologist is able to be accessed privately through Medicare chronic disease management plans and private healthcare funds. Funding options vary depending on the clinic, the private fund type, and the level of coverage. When referring a patient, it is important to talk to them about the possible out-of-pocket costs, and they may not receive 5 free allied health visits. Out-of-pocket costs will vary depending upon the provider, so explaining this when formulating the team care arrangement and making the referral will avoid any disappointment or unexpected costs for the patient. The best way to find an accredited exercise physiologist is through the national website essa.org.au, where you can filter your search by postcode and speciality, such as mental health. You can also search for allied health professionals by postcode via the National Health Services Directory. On the Brisbane PHN website, you will find some useful resources about exercise and mental health, including a variety of patient fact sheets that are available to download on the Exercise is Medicine website. An accredited exercise physiologist is an evidence-based practitioner who is able to ensure your patients move safely and towards a better physical and mental health. Engaging in AEP will provide a broad spectrum of opportunity to facilitate education in a variety of facets, including self-care and quality of life pertaining to individual health. Exercise is medicine. Let an accredited exercise physiologist move you towards better health.